How do you know if it's a ventricular arrhythmia right away when you're reading your EKGs? Well, I'm about to show you how now. Hey guys, Wilker Patrick, nursing educator inside Corsetta, and we're going to go over ventricular arrhythmias and how you can identify if it's a ventricular arrhythmia pretty much right away. So your options with ventricular rhythms is premature ventricular complex, so PVC, ventricular tachycardia, ventricular fibrillation, and then you have idioventricular rhythm. The highlight of a premature ventricular complex is that it is spontaneous and random of an impulse that starts in the ventricle before the next sinus impulse. All right, so it's a widened QRS complex that just interrupts the underlying rhythm. So as you guys can see in this example, let's use those steps for EKG interpretation. Step number 1, find the P wave. All right, so the P wave, is it upright? Is it before every QRS complex? And is it ever absent? And as you guys can see here, the P wave is checking out. So we move on to the PR interval. Measuring the PR interval, we can see that it's within normal range because it is less than that 0.20 seconds. So your 5 small boxes. Okay, so that checks out. So next, moving on to the step number 3, measuring the QRS complex. So as you guys remember earlier in this course that we talked about, the QRS complex is actually going to be telling us if it's a ventricular rhythm or not. So we're in ventricular rhythms now. So what does it mean? If you have a widened QRS complex at all through your rhythm, you can narrow out your options to ventricular rhythms here. All right, so the characteristic once again is that there is a random and spontaneous widened QRS complex that interrupts the rhythm and the P wave that's coming up next. All right, so as you guys can see here in this rhythm, we have the underlying rhythm here. It looks regular. And then we randomly have this giant widened QRS complex that just interrupts the rhythm. All right, so this is the characteristic and what it looks like of a premature ventricular complex. Now, most of the time, guys, in your EKG exams, you're going to have the underlying rhythm be part of the answer, and then it's going to say with a PVC. So you want to make sure that you interpret the actual underlying rhythm too. That way you can answer the question correctly. So in this case here, we want to measure the rate and the rhythm. So step number 4, where our rate is here, 1, 2, 3, 4, 5, 6, and then you do not count the widened QRS complex, so in this case the PVC, as part of your rate. All right, so let's start once again. So 1, 2, 3, 4, 5, 6, skip that big QRS complex, 7, 8, 9, 10. And then we don't count that big one again. So here our rate is 100 beats per minute. All right, so this answer, you might see this in your EKG exams, is that they're going to put the underlying rhythm in with your answer similar to this. This is sinus tachycardia with PVCs. So that would be your answer in this case. But really, guys, make sure you remember that and write it down, that you don't ever count the PVC or the widened QRS complex that spontaneously occurs as part of your rate. All right, next is ventricular tachycardia. This is a very famous rhythm that people talk about all the time in nursing school, and it's because it is a really critical rhythm. So you guys need to make sure you know how to identify it. But it's actually very easy to identify ventricular tachycardia. Hey guys, it's Wilker Patrick, nursing educator inside Corsetta. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. So ventricular tachycardia is defined by 3 or more PVCs in a row. Now, guys, this is very important. As you guys can see here, we have a very consistent widened QRS complex in this example, but take a look at this. We have another example of ventricular tachycardia, but it looks like there's an underlying rhythm, right? Well, as you guys can count here, there's 1, 2, 3, 4 widened QRS complexes in a row. That's greater than 3. So this is actually considered ventricular tachycardia on this strip. So make sure you guys write that rule down, that 3 or more PVCs in a row is considered ventricular tachycardia. All right, so let's get back into the characteristics. So let's go through those steps. Step number 1, find the P wave. Absolutely no P waves in this example. So step number 2 is also eliminated. Step number 3, measure the QRS complex. Well, if you guys measure that QRS complex, it's widened. It's greater than those 3 small boxes. So once again, that's how you easily identify it's a ventricular arrhythmia. So in this case, we do have that. And to measure the rate and the rhythm. So in this case, it's not as important to do step number 4 because we know that it's ventricular tachycardia just by the looks of it. But you can measure the rate, of course. That's always a good habit to do your steps no matter what. So if you measure this rate here, you get 180 beats per minute. Now there's some additional definitions that you might need to know and write this down. Monomorphic versus polymorphic. Monomorphic means one, right? So we know that there is one type of widened QRS complex. So this example is a monomorphic ventricular tachycardia because all of those widened QRS complexes look the same. Now with polymorphic, you're going to see a rhythm similar to torsades de pointes. Now we mentioned torsades de pointes earlier because it's related to a widened QT interval as well, because that's what causes the polymorphic. So there's more than one type of widened QRS complex. So you're going to see kind of an inconsistent appearance here with the QRS complexes. They're not all going to be the same size or same shape, and it kind of looks like they're winding into each other. So that is torsades de pointes, but it's just another version of ventricular tachycardia. So that may or may not be tested on your EKG exam. All right, so moving on to ventricular fibrillation. So ventricular fibrillation is also one of those rhythms that most people can just identify because it just looks like chicken scratch. There isn't real obvious widened QRS complexes. This just looks like there's random scratching on the EKG rhythm strip. So the characteristics, if we go through those steps, there's no P wave, there's no way to measure a PR interval. The QRS complex even is not able to be measured. So that's one of your major characteristics. If you can't measure a QRS complex, then it's likely ventricular fibrillation or, of course, asystole. But ventricular fibrillation is just uncoordinated and rapid twitching of the ventricles. So it's just like the heart muscle is having a seizure. So most of the time, the monitor is not even going to be able to get a heart rate. So this is a pulseless rhythm that you'll see here. And this, of course, is an emergency. And then the last one with ventricular rhythms is idioventricular rhythm. All right, so an idioventricular rhythm is characterized by a non-discoverable P wave, a widened QRS complex, and a rate of 20 to 40 beats per minute. Now, compared to your other ventricular rhythms, you guys notice that these rates are most likely high, of course, with ventricular tachycardia. But in this case, with idioventricular, the rate is slow. So this is what an example of an idioventricular rhythm looks like. So let's do those steps. Step number 1, find the P wave. There's no present P wave, so we can eliminate step number 2 because we can't measure a PR interval. All right, so step number 3, the QRS complex is widened. So we eliminated all the other options. We know it's a ventricular rhythm now, but let's look at the rate and rhythm. Step number 4. So if we measure out the rate here, we have 40 beats per minute. All right, so what is that characteristic of idioventricular rhythm? It is a rate of 20 to 40 beats per minute. Another little pathophysiology here. If you guys remember back where we talked about the SA node, the AV node, and the Purkinje fibers, do you guys remember what the Purkinje fibers rate is? It's 20 to 40 beats per minute. So idioventricular rhythm is related to the Purkinje fibers firing. Now this rhythm is a very big emergency as well. This is something that could lead into a ventricular tachycardia or a ventricular fibrillation, or of course an asystole. This is a rhythm that needs to be taken care of immediately. But if you measure out the rhythm, it's going to be consistent. So the R to R intervals are also consistent. So the biggest characteristics here, once again, no P wave, a widened QRS complex, and then the rate is 20 to 40 beats per minute. All right, guys, I hope that made identifying ventricular arrhythmias a lot more simple for you. If you guys haven't already, make sure you guys download our free EKG study guide and our website on tactilevr.com. And it's also in the link in the description below. Thank you guys for watching, and we'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.